Danielson. Steve?
It's Brian.
No, definitely Steve. Right. You're probably wondering why I'm making this video. Well, today I would like to talk about jumper's knee. So, jumper's knee, also known as patellar tendinopathy. God, it's such a hard word to say. Sorry, we'll just roll with it. So this is an injury, it's an overuse injury. So it's an inflammation or injury to the patellar tendon, which is caused by running, jumping and hopping. Go to the video. Like I said before, the way it happens for jumper's knee is running, jumping and landing. So that's what I'm going to do now. Just watch for the finish. I hope you enjoyed that video. So, the differential diagnosis of... Sorry, hang on a second. The differential diagnosis of jumper's knee is as an anterior knee pain. So with jumper's knee, on palpation of the patellar tendon, which attaches the bottom of the kneecap to the tibial tuberosity, there is tenderness all around the area of the knee, so the kneecap. The knee is in an extension. There is more tenderness around the patellar tendon as the quad. If there was a quad here, it's activated. But when it's in flexion, there shouldn't be as pain and tenderness as the quad is relaxed. Due to jumper's knee being a weakness in the patellar tendon, if this isn't looked at or treated, it can get worse, which then will cause a tear. Because it's a tendon, it takes longer to heal as there's less blood flow around the area, whereas a muscle heals quicker due to there being more blood. Tim Watson's 2016 article on soft tissue healing says that there's 4 stages of soft tissue healing. Stage 1 is blood, which can last up to 4 to 6 hours. Stage 2, which is inflammation, which could take 1 to 4 days. Stage 3, which is proliferation, which is a onset to 24 to 48 hours, which doesn't get to peak within 2 to 3 weeks. Then after its hit peak, remodeling starts, which is stage 4. That can last to 4 to 6 months, depending on how much trauma there is to the area. I've mentioned it, but the symptoms is pain when bending the knee, swelling around the area, loss of movement, which could be due to the pain and the swelling. And when there's put too much load onto the knee, that's when there will create more pain. So, I'm starting to be in pain by saying so much. So epidemiology, which means who it affects most. So this is sports performers who do a lot of training, a lot of competing, a lot of running, jumping and landing, which is like basketball, volleyball. This is an overuse injury, so the more they use it, the worse the injury is going to get. But then it also affects the older generation due to degeneration of the soft tissue of the tendon.
No time. Home videos.
Are you ready for my home videos? The etiology of this injury is that there is a lot of stress to the tendon, which is the patellar tendon. There is a lot of repeated stress due to overuse. During basketball and netball, there is a lot of jumping and landing. If you don't land correctly and there's too much stress on the patellar tendon, this is what causes jumper's knee. There is a high risk of this happening each time you land wrong or land too hard on a surface. The more power you push through after you've landed wrong is what causes more stress on the area. Anatomy. For this one, I've used Chris Jeremy's book, 4th edition. So, this involves the quadriceps. There are 4 muscles in the quadriceps. The vastus lateralis, the vastus medialis, vastus intermedialis, and the rectus femoris. These all insert onto the patella, which then go to the tibial tuberosity to form the patellar tendon. The quadriceps is what helps the knee go into extension. When the patellar tendon is inflamed, it makes it harder for the knee to be extended fully, as there can be inflamed, painful and swelling. Alright, so now we're on the clinical assessment side of it. So now we're going to diagnose the injury and where it is. So there was a study by Richmond and Rath, 2010, which showed that in extension you can palpate the patellar tendon and around the area to see if there's any tension or pain. There is a pain scale of 1 to 10, which your client sportswoman will tell you when they're in that pain. So after you've looked at that, you can compare it by doing a 90-degree angle flexion of the knee, palpating again to see if there's any change, to see if there's pain and if there's less tension than when it is extended. But when you start this, you should be asking your sports performer client their history, if there's any repeated injuries, if they had it before, any illnesses, what could cause the patellar tendon to degenerate and then start jumper's knee. Same study, now this time the participant would be standing. So with the injured knee, because they're weight bearing, they're putting weight through the patellar tendons, which could cause more pain. So then you can palpate it when it's fully extended to see again if there's any tenderness and if they show any signs of pain, or like whether they shake or from their facial expressions. And then once you've done that, you get them to flex their knee slightly on a 30-degree angle and palpate again around the area of the patella, the knee, the tendon, all of it, to see if there's any pain or tenderness. Tenderness. God, keep messing up on this one. Tenderness. Third one you can use to test the area will be doing a single leg squat, which you get your client to. So he can elevate his foot. This way we're using a book. So he'll go down on a single leg squat as far as he can go. Well, as you can see, there's no injury on this one, so it's not a positive test as he's got no pain and can go full way. But then you would also do it on a decline, on a slope, to see if it's again, as it's more elevated. To diagnose the area is to do some walking up the stairs, walking down the stairs, jumping, hopping. This will all cause stress on a patellar tendon, which will then be able to diagnose if that is the injury they have. Special test for the injury will be the anterior draw. This test usually diagnoses ACL injuries, but we can use it to diagnose if there's any patellar pain. So with the client, you flex their knee to a 90-degree angle, place their foot flat on the couch. You can sit on it to keep it in place, tracing your thumbs down the joint line, putting them in place, keeping them tight, and then vigorously pulling the knee towards you to see if it causes any pain to the area. If there's pain, this means there's a positive test. The second special test that we can use to bring up patellar pain would be the Lachman's test. For this one, we need the patient to be in a 20 degrees flexion, encouraging them to keep still and relax. You place your left hand onto the femur with your hands wrapped around the hamstring, with the other hand holding on to the proximal tibia. Then you've got to pull the knee towards you to see if there's any disalignment and any pain on the patellar tendon. There can be 4 stages to diagnose whether a person has patellar tendinopathy and how bad it is. There's Blesnia, such a hard word to say, Blesnia and Kennedy's. The first stage is if there's pain during the activity and nothing else. The second stage is if there's pain during the activity and after the activity. The third stage is if there's pain during, after, But if the after pain is more painful than it is before, then that is worse than the second stage. The third stage is if there is a complete rupture, which means the person is definitely injured their patellar tendon. So after you have diagnosed the injury, you move on to treatment. So if it's just happened, you can just encourage rest or decrease the amount of jumping and stuff they're doing depending on how bad the injury is. You can also apply ice to the area to try and decrease the swelling, decrease the pain, and also increase the range of movement as the injury has happened. You can also invest in getting into patellar strap, which goes just below the patellar tendon, to keep it in place and put less stress on the area when someone's doing jumping, landing, all that sort of stuff that can cause the injury. One of the main ones that all clinics now use, and it's also brought up by Joseph 2012 in his article, is deep friction massage. So you can start off a massage by we're going to do the quad and around the knee and on the patellar tendon, because that's where all the pain is. So hopefully we can, by doing the massage, you can release tension, get rid of adhesions, increase blood flow. So you can start off with light effleurage around the areas. You can do lymphatic drainage. And then you can start trigger pointing where there's more pain and tenderness around the areas. You can tell if it's hurting the client because they'll twitch and trigger, maybe make a few noises. The next part of the treatment is electrotherapy. This will go alongside manual therapy. It's best to do manual therapy first to get the feel of the touch and warming up the muscles, and then go into electrotherapy. So we've got two for this one. The first one is a low power laser, which is a machine that you put around the area. It puts a high beam of light through the area, which will then heat up the muscle, increase blood flow, the same as massage, and also it can go deeper into the muscles, the same as shockwave. These two machines will be shown in the video later. Shockwave causes a high pressure disturbance and acoustic shockwaves. This is at a large amplitude. This will help break down adhesions around the area of the patellar tendon and up the quad. This will be alongside all the other electrotherapy. Tim Watson's journal on shockwave is where I got this information from in 2015. Like I've explained in my home videos about treatments, all the treatments there are and what they do. These are machines. We've got the low powered laser. Follow me this way. We've got the shockwave. I've already set it up using protocols to jumper's knee. So, press start. Can you hear that noise? This is the reason I'm showing you. It's quite a scary sound, so it sounds like a bit like a taser, but it does help break down adhesions, which is a good thing. So I'll give it a try if you can. Once the treatment has been done to reduce pain and increase range of movement, you can start doing the rehab. There are 4 stages of rehab. The first stage is isometric loading. This should be done with minimal pain. If the pain gets to at least 5 out of 10, then you need to start rethinking on what you're doing, as you're causing pain to the client. For the first set of exercises, you can use a resistance band. For the first exercise, it's going to be resistance band extension. So the first exercise for patellar tendinopathy is knee extension. You can do this using a resistance band. Put it to a stable surface and then put it on the client's foot by their ankle. This should be done at least 5 times for 45 seconds each. At least 2 to 3 times a day, maybe. So the client will extend their leg and hold it and then back down. Like I said before, if they get too painful, then they'll have to stop. They should be doing at least 70%. So at least where the knee allows to go. The second exercise for this stage is a Spanish squat. For this one, you need to put the resistance band onto a stable surface and then get the client to step into it and put it behind their knees. So this pulls forward. This is good. This is why it's good for patellar tendinopathy. It's like a reverse wall sit. So you get your client to sit back into it and then just hold it there. This should be done like the last one, 5 times for 45 seconds. And back up. The second stage for rehabilitation is isotonic loading. This should be done after a client is able to do exercises with 3 out of 10 pain. This stage helps to increase strength and range of movement. It should mostly be done with a single leg stance. So you can do a single leg press, a split squat, and again leg extensions. These exercises, it should be done at least 3 to 4 reps. The load for this is at least 15% of rep max. This should be done to at least fatigue. So I'm going to show you a split squat as I've got no one to demonstrate it. So it's like a lunge, but instead of going straight forward, we're going to go straight down, so as far as you can go. So we'll start off with 10% knee flexion, but then the more we do it, the lower they can go, so more flexion within the knee, so at least 90%. Rehabilitation is energy storage loading. This is to restore energy storage and to regain power. This can be done when a client / sports performer can do 4 to 8 reps of single leg press of at least 150% of body weight with at least 3 out of 10 pain. With this stage, it will start being more sport specific, so starting with like basketball and stuff like that. This will when you'll start introducing more jumping, landing and change of direction, which help to cause the injury but build up the strength to be able to do it again more safely and effectively. This should be done with at least 8 to 10 reps with a low intensity before stage 4. Final stage of rehabilitation is return to sport. For this one, like stage 3, there are more sports drills. But to be able to do this, you have to do the 3 hop test first and the vertical jump to test for the suitability to see if they are able to do it. For the vertical jump test is to see how high a client / sports performer can get by using power. For the 3 hop test, I'm going to have to show you in the great outdoors because there isn't enough room inside. For this test, it's to test the power of the lower body. So you have to do 3 consecutive hops and then measure how far they get at the end. But for this one, I'm just going to show you the hops and not going to do the measurements. For this stage, it's best not to do 3 training sessions a week of a high intensity, as you need to allow for recovery. Also, during a session, you need to watch out for fatigue, as when a sports performer / client gets fatigued, this is when they have less bend in the knee when doing a jump, which then causes patellar tendinopathy as it's an overuse injury and it keeps happening. After the 4 stages have been complete and the sports performer is ready, they will be able to return to their sport, which is why the last stage is return to sport. But this is it, so thank you to everyone that has helped me, my friends, my family. I'd like to thank Darren, John and Ian for helping me out. Thank you for watching. You've been here with Sam Smith. Please look at the references. There's references to all the information I've put in this video. So see you soon. I'm going now. I've enjoyed it. You know. Oh, what a tiring. See you later, Steve. Ryan.